Okay, doc. Then some patients who have type 2, they won't respond to the desmompressin. Why? Because if there is no production at all in the endothelium, उनको पीटने से भी क्या बोलेगा? अगर वो पढ़ाई नहीं करे तो पीटने से क्या फायदा है ना? So that is the thing. Now, doctor, we can also give factor 8 concentrates and cryoprecipitate. Do you want to give? It is not recommended. Cryoprecipitate, what are the two factors which are very rich? Factor 8 and fibrinogen, very rich. But cryoprecipitate is like 10 fathers to one illegitimate child kind of a situation. You will take plasma of multiple people, concentrate it, create a cryoprecipitate. Kisko HIV hai malum nahi. So there is a reason infection rate is very high in the case of the cryoprecipitate. Don't give NSAIDs and aspirin, because the job started by God will be finished by you. Because already there is a qualitative dysfunction in the platelet adherence. On the top of it, you want to acetylate a platelet and make it dysfunctional too much. You should not give. Now, doctor, the next important situation is hemophilia. This is another high school topic. Biology teacher taught X-linked recessive disorder, factor 8 deficiency. Some of the princes in the English dynasty, Russian dynasty, Tsars also suffered very big disease. Now, doctor, how do we classify? We used to have one professor of hematology in our MD. He once brought the history of England and read a paragraph about hemophilia to a patient of hemophilia. It's a good practice, doctor. You think that writing hemophilia precipitate, factor 8 precipitate is over your job? No. Our job is not only treating, talk to patient, share empathy, and probably if you are bleeding in the home because your husband has beaten you in the night or wife is not feeding you in the morning, patients will always be there to share with you. So as a doctor, you always have that privilege. What is that called as in psychiatry? Phenomenon of transference. As a psychiatrist, when you sit in the OPD, somebody keep talking about all the sexual molesty happened in her childhood. Ultimately, your mind becomes pathetic, because all the pathetic experience of the patient had been heard by you for about half an hour to 45 minutes. Finally, you will be thinking, there was neither a molesty nor a sexual adventure, nothing is there in my life, I was doing MD, DM, everything, and you will be going home in misery. That's a phenomenon of transference. What is meant by phenomenon of counter-transference? Morning, the psychiatrist's wife said, by the time you come in the evening, my attorney will be ready with the papers of divorce. Then the psychiatrist sat in the OPD. Patient said, doctor, I am having lot of domestic violence, my husband is beating, what shall I do? Oh, is he beating? Take a knife and kill him. Or otherwise, I will give you a nice attorney's number, my wife already have it, and you can call him and your husband will be sent on an unbailable arrest warrant. So there is counter-transference. That's the reason, though we, one of our professor of medicine used to say, though the night duty you have grown beard, what is the need of demonstrating it to the patient? It takes 2 minutes to shave quickly in the morning and join the ward rounds. But we never did it in the entire MD, because where is the time for shaving? There was no time for micturition also. So much was the patient load. But still, doctor, we need to tuck a smiling face, meet the patients as a confident human being, though there is a disaster under our feet. we are disqualified in the entrance exam, already the result came, anything may be there in the under our feet. So now doctor, how do you classify? Why did this come? Because English history. If it is 10% normal factor 8, you call subclinical. When it is 5 to 10% of the normal factor 8, you call mild. 1 to 5% only you call moderate, and less than 1% of the normal levels are there, then that become a significant factor 8 deficiency. ये percentages को मालूम होने का जरूरत क्या है? पहला वो बताओ. Because a hemophilic patient, if you give factor 8 concentrate, your aim is not to increase it to 100% like a normal fellow. Your aim is to move him from a risky state into a non-risky state. So your aim will be only to make his factor 8 levels to rise up to 10% of the normal people. That much dosage only you will give. But once more, if your hemophilic patient is about to undergo appendicectomy or hysterectomy or any surgical procedure, then you must give that much dosage of factor 8 that his factor 8 levels will go up to 100%, and then you need to operate on him. And having 10% of what other normal people have also is called mild. Without any bleeding problem, patient will be comfortably living. So that is the story of factor 8. Second thing is how frequently you need to give. You want to give TID, BID or OD. It depends on the half-life. So if you take the factor 8, 12 hours only is the half-life. Even if you give full factor 8 and increase his factor 8 levels to 100%, it is not going to live beyond 12 hours. That's the reason whenever a patient comes in crisis, you need to calculate according to the body weight, and if he is bleeding, then you need to know whether it is moderate or severe, and accordingly you must judge how much is his present level, how much I need to raise to stop the bleeding, and that much factor 8 only you will inject. How to calculate the factor 8 levels? You will have it in Harrison and CMDT, but don't read it, because unless you are doing it practically on one of the patients in the OPD in the night in casualty who comes with hemophilia, reading won't help anything of those calculations. But you need to know the logic. How much percentage should I raise? Then more than 75% of hemophiliacs, especially hemophilia A, 50% are HIV positive. Why HIV? I know a patient who was HIV, HBV, HCV, all the three positive. Because of the recurrent transfusions, but currently we are doing a better screening. We have got a better screening procedures. Hemarthrosis, especially knee joint involvement, is the most common site for the development of hemarthrosis. That leads to a progressive joint destruction, and you may end up in doing synovectomy to relieve it. Second most common location is intracranial bleeding can be there, as what you can see here, which can lead to the development of mortality. And any head trauma is potentially dangerous. There can be hematuria, hemospermia, post vasectomy there can be development of a hemoscrotum, anything is possible. Now how do you, what is the important challenge in managing a patient of hemophilia? If you listen the history of that hemophilic guy who is about 14 years, the story starts by saying that in nursery while playing, first time when all kids are playing, the baby fallen down and had a swollen joint. That time factor 8 was given. After that he was fighting with his classmates and got bruised like anything, and then transfusion was given. Multiple times factor 8, when you give the factor 8, body develops auto antibodies, and factor 8 next time when you give it will be ineffective. How do you recognize it? Normally if you take a plasma of a patient and try to add factor 8, APTT should normalize, and if the APTT fails to normalize, then that means there is a factor 8 inhibitor which has developed in the patient. Any prolonged APTT with low factor 8 assay is the classical way to diagnose. And how do you treat? If he comes with hemarthrosis with huge blood in the knee joint, first give painkiller, immobilize the joint, factor 8 concentrate will be available for you, and this you need to basically inject, and your aim is to not increase the percentage to 100%. And generally we don't give cryoprecipitate or FFP because of the risk of HIV, HCV. And some people with mild disease, just like von Willebrand, even they will also respond to desmopressin treatment. Then what is hemophilia B, doctor? B is factor 9. It is very similar. It is also X-linked recessive, but unlike hemophilia A, where vasopressin injection has got a role, desmopressin, it doesn't have a role in factor 9 deficiency. That is a point you need to fundamentally appreciate.